name is Terry Goodley, and this is my wife Margaret. We live in Pinchbeck near Spalding in Lincolnshire, and we live a very, very social life. We always have done, really. Lots of friends, go lots of places. For many, well, ever since I've known Margaret, every year we go on holiday and all things, go away for odd weeks, things like that. Yes, we've led a very, very active life, really.
During that year of 2011, it was that I could feel a change in him. Physically, you could see that he was ageing. He slowed down so much. I was finding it difficult to do all the things that he used to do, but still was really pushing and pushing, which he always has done. And then once we started going to GPs to try and get an answer, we were generally fobbed off. So although we had seen several GPs as well as our own, because he wasn't always available, it was very frustrating to watch Terry becoming less active and becoming more and more unwell. It was just frustrating that nobody would listen to me. And look, this is the man I live with. I know there's something going on. And there always just seemed to be another pill, or do this or do that. But really, even though he was hospitalised, that between late September and early December, he was hospitalised 4 times. At the end of that, we really had got no satisfaction and no accurate diagnosis, or really no firm diagnosis about the heart condition.
I've got to be honest, I think I got to a state where I just couldn't care less. You know, let me just lay down or somebody inject me and put me to sleep for a few weeks or something. I was so, yeah, I was at the end of my tether, and I'm sure Margaret was as well, because living with somebody like that must have been an awful pain for her, to be honest.
Well, from the first time that we met April, there was a wonderful feeling that here was someone who obviously knew what she was talking about. Doesn't sound that she could see the problem and knew positive ways of dealing with it. So this was very comforting and reassuring for me, because at last here was someone I could talk to. And from the first time I met her, I knew that I could always phone her at any time when she was working, or she gave me the number of the Marie Curie nurses, which I could phone during the evenings or the nights, which I did have to do. So from that first consultation, there was backup immediately and support. So that was going to be a big bonus and really helped me so much through the difficult months ahead. April was just so efficient. You just hardly could believe that whatever she said was done. But April was also very caring. She had a wonderful choice of words. And from the beginning, it was very much, I will do everything I can to help Terry, but I'm not sure what the outcome will be. If the outcome is not so good, I will be there. I will make sure that all his wishes are complied with. He will be looked after well, you know, and we were able to make the decision that he would be looked after at home as much as possible because of the bad experiences he'd had in hospital.
And there is no doubt that if April hadn't turned up, there is no doubt at all that I would be dead. No question. If April was to say, I'm emigrating to America tomorrow, I would be uneasy. Who do I phone if I, you know, and that is one of the main things which has made me be very close to April, because after all, she saved my life, and I always know that if anything was to go wrong, I know that I've got somebody there that it's a fair chance that she'll put me right again.
April is a very special person because she's very professional, she's very dedicated, she's very knowledgeable, but also she's very caring, and she has a wonderful choice of words when you speak to her, and we just want to do everything that we can to promote the heart failure service so that other people can get the help that we have had.
I mean, obviously what made her special to me is in just plain English, she stopped me from dying and brought me back to life. Not just brought me back to life, but brought me back to life with good quality. Not just life, but a good quality life. I've looked through the dictionary to find words, and I really can't find any really that's good enough to describe her. I mean, in anybody's book, and I'm not the only one, I've spoken to other people now, Margaret and I, that have been seen to by April, and they say the same thing. She is. I'm sorry if I, you know, am embarrassing her, but you want the truth, and I'm telling you the truth.
April will never know how much we and other people appreciate the work that she does. She is really a wonderful person, and we thank her for everything.
My message would be, bless you, April, and thank you for being there, even though it's on film and your husband might be watching. I love you to bits.